Hello, I'm Lori Ezell. I am a member of the Spring 2016 RN Refresher Program at Anne Arundel Community College, and I'm here this evening to demonstrate my head-to-toe assessment skills. So let's get started. First thing I'm going to do is clean my hands and introduce myself to my patient. Hello, I'm Lori Ezell. I'm going to be your nurse this evening. Can you tell me your name? Okay, Carol Jones. And Carol, why are you here? Oh, okay. She's here for a gallbladder procedure. And are you going to have your gallbladder removed? Okay, great. That's called a cholecystectomy. And can you just tell me what today's date is? Okay, March 16th, 2016. Well, Carol, the first thing that I'm going to do is I'm going to perform something called a head-to-toe assessment. And we're basically going to check everything from your head down to your feet to make sure that you're good to go for surgery tomorrow. So the first thing that I'm going to do is I'm going to check Carol's eyes. I'm going to shine this light into her eyes just to make sure her pupils are equal and reacting to light, which they are. Then the next thing I'm going to do is look up her nostrils, her nares, and I'm going to make sure that the tissues are nice and pink and perfusing and moist, and they are. Now, Carol, can you just open your mouth for me and say, ah? Okay, excellent. Thank you so much. I'm just going to shine the light up there to make sure that the mucosa is nice and pink and moist the way that it should be, and it is. Now, the next thing that I'm going to do is I'm going to take a look at your lymph nodes, and I'm just going to assess them by just feeling them to making sure they're not swollen, which they are not. And then I'm going to listen to your trachea. Just take some nice deep breaths. Okay, great. The next thing I'm going to do is I'm going to listen to something called an apical pulse, and that's the pulse that you usually typically expect to get when somebody's listening to your heart, just underneath your on your left side here. How we measure that is it's your fifth intercostal space midline to the clavicle. So I'm going to measure that now. 1, 2, 3, 4, 5. Okay, great. I'm just going to take a listen here. By the way, while I'm listening, I'm going to make some observations about the S1 and S2. The S1 is the lub. That is a tricuspid valve closure. And then the dub is the aortic pulmonic valve closure. So that is S1 and S2. Okay, so I'm just going to listen to that. Okay, and then what I'm going to do before we move too further on is we're going to look at something called JVP. That's jugular venous pulse, and that's on. We're going to turn you on your. That's on the right side. So we're going to lift the head of your bed up 45 degrees, and then we're going to take a. We can't really see a whole lot with JVP, but we do want to assess that for anything unusual. It's typically just an informal measurement for central venous pressure. So the head of your bed is up. We're turning you on your left side. And again, we're observing it on the right side. Okay. Okay, great. So we're done with that. And then what I'm going to do is I am going to, I'm going to listen to more heart sounds. Okay, the first thing that I'm going to listen to is the PMI. And the PMI is sort of found where we take your normal pulse. So what I'm going to do is just measure 1, 2, 3, 4, 5, intercostal space, left mid-clavicular. That's the only, let's see, left mid-clavicular down here. Okay. Okay. Okay, and then we're going to listen for something called the mitral valve, the Yeah, mitral valve. What did we just do? The mitral. And now we're going to listen to the tricuspid valve, which is the fourth intercostal space. 1, 2, 3, 4. Left mid clavicle, which is mid clavicle is here, and so that left mid clavicle. Okay, very good. And then the tricuspid valve is going to be the fourth left, let's see, left, fourth left, 1, 2, 3, 4, left sternal border, which is here. And we're going to listen to the tricuspid valve there. Looking at the clock. Okay, and then the aortic valve is the second intercostal space, 1, 2, and that's going to be at the right sternal border, so that's going to be over here. Okay, right sternal border, okay. Second intercostal, right sternal border, okay, got it. Okay, excellent. So just moving on, we're going to now take a listen to your lungs. I'm going to start with your anterior or your front, and I'm going to listen to the lobes, starting with the apices of your lungs. Okay, very good. And then I'm going to listen to the right upper lobe, the left upper lobe, the right mid lobe, the left lower lobe, and the right lower lobe. Okay, that's the anterior. Now we're going to listen to your posterior. I'm going to just turn you on your side, and this one's a little easier. There's just 4 lobes here, so we're going to listen to your left upper lobe first, and your right upper lobe, and your right lower lobe, and then your left lower lobe. Okay, great. Now, the next thing that I want to do is just take a look at your abdomen and make sure that everything looks good there. There is no unusual. Just make sure that it's supple and resilient. Nothing going on, no rigidity. Now, you did have a BM. You had a fleet enema. Okay, great. Perfect. So everything feels normal. I'm just going to listen to your bowel sounds. I'm going to make a quadrant on your belly and listen to the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Okay, great. Then the next thing I'm going to do is I'm just going to look at your skin. You know, sometimes when you come into the hospital, you just have to make sure that, you know, there's no friction, there's no bony prominence that's going to continue to get chafed. So I'm just going to take a look at your skin and make sure that everything is normal. Okay, great. Skin turgor, I'm just pinching a little here. Excellent, very resilient. Now I'm going to take a look at your legs, your lower extremities to make sure that they're also good. And just feel them, everything warm to the touch. The skin, when I pick it up, is resilient. And I'm going to check it for pitting edema. I'm going to press down against the bony prominence in the shin, not seeing any edema. Everything looks great. I am going to check your nail beds for perfusion, capillary perfusion. That's a good sign that your circulatory system is working. Everything looks great. I'm going to check the right hand as well. Okay, you've got excellent perfusion there. I'm going to just check your feet. Okay, great. Just do a little range of motion. Okay, raise your left hand. Excellent. Raise your right hand. Excellent. Raise your legs one at a time. Okay. And then I think that's pretty much it. No, I'm going to check your strength. If you can just push against my hands. Okay. Excellent, excellent, excellent job. Well, thank you so much for letting me come in and do this head-to-toe assessment. Now you know that you're good to go for surgery tomorrow, and I look forward to seeing you when you come out. In the meantime, you've got the call bell here. You know that I'm going to be here for the rest of the shift. If you need anything for pain, don't hesitate to ask. I will also come in very frequently to make sure that you're comfortable and just resting and ready to go for tomorrow. Okay? Thank you so much, Carol. It's a pleasure meeting you, and I look forward to working with you.